health and human services combined. But be that as it may, there is still a division of labor in terms of managing long-term care. Workforce. I mean, this is not just a medical nursing kind of an issue. This is a workforce issue. And it's going to, you saw those lines in the graphic just a few minutes ago. This is going to be a workplace issue, and people may as well get accustomed to that because it's coming.
And I think one thing that you're saying there, and if I may just clarify it, is that as to describe it as a train wreck, and the scope of the train wreck is because it's going to take a long time to implement some of the solutions that we're going to speak, I think, at length about in our second half hour. But if I'm not mistaken, it takes a fair amount of time, not just to build a long-term care facility or a bed, but it takes a heck of a long time to train more primary care providers, to train more nurses, even nurses' aides. It's a lot of education, and it's kind of like a shift in our philosophy, a heavy shift to take care of a growing elderly population.
Well, there's the public policy aim of the Long-Term Care Commission, and we've adopted this in our work plan. It's on 5 websites now to get a researcher to do the work. The public policy aim of the Long-Term Care Commission is to come up with recommendations to the legislature that will provide more service to more people at less per beneficiary cost. Now think about that.
Right.
More service, more people, less beneficiary cost. Now that can only mean one thing, and that is a bigger emphasis on home care. Because that's where people want to, 87% of people in the survey said that's where they want to be anyway. They would rather age in place, which is the code word, I guess, in the industry. But that's where we're headed, and the Long-Term Care Commission is not understands fully that we just can't throw a bunch of recommendations on the doorstep of the legislature. We also have to come up with a rational solution for dealing with the problem. So,
for our viewers, when is the recommendation due, or what's the plan?
Well, we're a little late now because we've had to raise money privately, and we have done that. We've raised money privately, and we've been successful at it so far. We've raised enough to at least do 1 year's work, but we expect a work product to come out on the first study. You know, where do we stand? Where do we want to go? How do we get there? Kind of stuff. Probably in a year.
Okay.
In a year.
In some kind of timetable to help present ideas to the legislature.
Yes. As a matter of fact, we should have. Well, our own internal timetable calls for the selection of the research guy next month.
Fascinating. I was just going to make one other small comment. It's something that you said really interested me, and that's that the goal, which is a noble goal, to provide more care to more people, understanding that there's going to be less resource. It strikes a chord because it seems almost that's what the national individuals are talking about, and the president. He's talking about there's more people to care for. There's the 40 or 50 million uninsured. We have to provide more services to them, to everyone, to our country, but we're going to have less. Right. And how do we accommodate that in a system that's very technical and technological? And how do we convince the healthcare providers to go into nursing and to go into medicine and to go into administration of facilities, knowing that there's going to be that added pressure? So it resonates. The long-term care crisis here in Hawaii resonates with the national thing.
Yeah, and I was just going to tag on to that. You know, sounds as though, you know, to be able to more adequately provide for the anticipated need, you hit upon an important point: home health care. Right. You know, remaining in the home, because that's where your loved ones are, right? That's where your support you know, comes from. But at the same time, hearing that, look, the number of long-term care beds is something else that we need to catch up with. And I was wondering, Craig, you know, I mean, as a practitioner, and seeing the kinds of patients and the families, right, that come before you and the needs they have, Is there
long-term
a
care.
consistency?
Long-term care is two different segments. I mean, long-term care is a skilled nursing facility status, which is rehab. You're getting patients to go home, and they're bedridden, or they're having problems with, say, the most common problem is a fractured hip or something, or they're decongestioned and weak after medical illness, and they're a little too ill to go home, but you want to get them walking and ambulatory. Okay, that's long-term care. That's our skilled nursing facility status.
I see.
So you want those kinds of beds. The long-term care domiciliary status, ICF status, where you just take care of patients. Nursing, that's more what you think of classic nursing home. We had our Medicare, surveyors come through. I mean, we're a highly regulated industry. So the nursing people that come through that look at our ward, we have about a half a dozen or 8 patients on ventilators on extended care. Ventilators and breathing machines. The kind of thing that 10 years ago I just took care of in ICU, in intensive care unit. Okay, but we have these chronic patients on breathing machines. We have behavioral problems that you couldn't send them home. Wanderers that difficult to keep at home or agitated. So there's always going to be a place for long-term care beds where you're going to have professionals taking care of this. But in the perfect world, yes, I think everybody should go home. I would rather be home rather than be in a facility.
Well, and when we do that, when we want people to go home, our insurances don't pay. They'll pay for home care, but they won't pay for the medicine when you go home. So if you need an IV antibiotic, you would stay in a long-term care facility to get that IV antibiotic. Insurance would pay for it there. They won't pay for it at home. And so we have to change our paradigm. There needs to be a paradigm shift, even with our payers, our Medicare, all the insurers, because they'll pay for the med in a long-term care. They won't pay for it at home. And where would you rather be? You would rather be at home.
They'll pay for the administration, but not the cost of the drug.
Yes.
Well, if it's parenteral, if
Yes.
it's intravenous, or
Yes.
or any kind of intravenous therapy or parenteral therapy.
And as we're wrapping up the first hour, and we're going to continue the first half hour, we're going to continue the second half hour, I guess would it be safe to say that addressing that paradigm shift is one of the tasks of the Long-Term Care Commission, to look and see not just where we are today as far as our shortage of beds goes and our community's needs, especially on the Big Island, which is our focus today,
That's right.
as senators from the Big Island, but also to see where we're going to be on your chart 20 years from now. Is that?
Well, let me be clear that there will always be a need for beds to take care of long-term care patients. Every case is different. I mean, Craig, you see that all the time. Every case is different. Every need is different. But there are going to be a number of cases where you got to put them in a bed.
Well, we thank you all for coming in and joining us today. We are going to continue this segment with more information, and we're going to invite our guests back. But today, this has been the beginning of a very good dialogue on long-term care. So thank you for joining us today.
Thank you.
Thank you.
Thank you very much.